Welcome everyone, and thank you for joining us for today's webinar for Best Results Comprehensive Evaluations and Clinical Assessments. I'm Haley Diaz, your host for today's event. And we'll also have Austin Rutledge, our Manager of Client Educational Development, joining us in the background to help with any questions you might have related to evaluations throughout the presentation. And so before the presentation, let's just knock out some logistics. Today's presentation is going to be recorded and it will be distributed to all attendees within the next 24 hours. And there are a couple of Zoom features we'll be using today and would love your participation in them. The Q&A feature is for any questions that you might have for our presenter, Dan, today. And I'll see those and share them with him at the end of the presentation for him to answer during a Q&A part. And if we don't get to your individual question, Dan or Austin will make sure to follow up with you individually after the session. And the chat feature is just for any general inquiries you might have. So feel free to post anything in there that you would like to share with the whole group. And so with that all taken care of, let's just get started. It is my pleasure to introduce today's presenter, Dan Thompson. Always an educator, Dan transitioned from teaching high school to focusing on instructional design and educational technology in higher education for the last decade. Throughout his career, he has assisted faculty in course design and development while also introducing new methods of utilizing educational technology in the curriculum to create a learner-centered environment. His background includes leading faculty development efforts at the Oklahoma State University Center for Health Sciences and the Kent State University College of Podiatric Medicine, and he holds a Master of Science in Technology Enhanced Learning and a Bachelor of Science in Adolescent and Young Adult Education from the University of Dayton. And with that, I'm happy to turn things over to Dan.
All right, well, thanks Haley for the intro and getting us set up for today. It's always a pleasure to have you kick us off. And thank you everyone for joining us today. We most certainly do appreciate you taking some time out of your day to learn a little bit about evaluations and clinical assessment. As you saw me flip ahead in error here, I do have a couple co-presenters with me today. So this is Dexter and Fitz. Since like the most of the world, I'm presenting from home. They always like to come say hello whenever I'm talking on camera. So if you hear someone singing in the background or maybe jumping through, no worries. I'm safe, it's just them. This probably isn't best practices for presenting a webinar, but I do have someone right here actually already joining us. So you've been warned in advance that I may be under attack at some point by these guys. So with that, let's jump into hopefully the more entertaining stuff than the cat on my desk. So today's objectives, as we talk about clinical assessments and evals, and we're going to be very focused on those, is one, we just want to talk about how to improve the effectiveness of your evaluations. So we'll have tips and tricks throughout, some associated with Leo, some not, just ways to evaluate what you're doing in your program and how to increase, again, the effectiveness. And throughout the theme that you'll see most throughout the day today when we talk about effectiveness is really about student learning, student performance, and how to use these opportunities of formative assessment through evals to improve student outcomes moving forward. Directly related to that are logistical barriers that we tend to typically see with any sort of clinical assessment, and that's training, communication, timeliness. These are all things. There's so many different folks involved in this process, and there's a lot of logistics involved. And so throughout my time in MedEd, these three different items here were really the pain points we see most often. And then finally, at the end, we'd like folks to be able to administer both pre-scheduled and on-demand evals in your didactic and clinical courses. And of course, we'll talk through there and have some best practices tips to go along with those. Okay. So let's jump right in. First and foremost, in thinking about didactic evaluations, I really broke this down. There's really just four that we use the most. I have the list to the right, and that's actually a screenshot from Leo and the different types of evaluations that you can have set up for your faculty and students. But when we look in the didactic courses, we're often thinking about those course evaluations where students typically at the end of a course are giving some sort evaluation about the effectiveness of the course. Faculty evaluations typically done at the same time. Those also can be done throughout the semester as well. And as we talk about on-demand evaluations, we'll see there's some opportunities for faculty to have different feedback more quickly throughout the semester, as opposed to always waiting until the end. And then the two that I'm going to highlight the most today are peer evaluations and self-evaluations. In 2021, even with so much of our education being done at a distance, we often want to try and get students to work collaboratively. And a large part of follow-up on that is peer evaluation, not only to make sure that students are doing their part, but also to allow students to think in a more evaluative, creative way about their peers' performance. So I'll speak to that quite a bit today, and those peer evals, and then finally self-evaluations. There's a number of ways in which we can get students to evaluate themselves so that they can self-assess and be more aware of their own performance, and then be able to identify how to improve that moving forward. Just a quick update on Dexter. He laid down. I might be in a safe zone for the next 30 minutes. Clinical evaluations. Again, a list here, pretty simple, basic list, but there's so many different things that we can do with this basic list. And one is just classic rotation evaluations. Students, after they complete that rotation, they provide that evaluation. And there's, this is definitely a learning process for those of us that are coordinating those rotations. It's a learning process for our preceptors and our clinical faculty, and it's also those logistical things that we need to do as well. So there's those, and that along with that goes with the clinician evaluations, where if in your program you do have students evaluate the clinicians with whom they work in those clerkship years, they're able to do that as well. Again, the main part that we see in clinical evaluations, or I keep using the term clinical assessments as well, are student evaluations. And oftentimes in the clerkship, this is going to be a one-on-one evaluation of student performance after some sort of patient encounter. I'll talk a little bit about preclinical experiences, the clinical skills experiences, where that might be with a standardized patient, and then also in the clinical years with actual patients in a true clinical setting. One valuable way, just as a quick tip before we get into more specifics and how to overcome those barriers I mentioned before, are that when you have student evaluations, it's an opportunity for students not only to become self-aware after a clinical experience, it's also an opportunity for them to reflect and create learning objectives for themselves moving forward. And this is a process I'd used in the past with healthcare education students. That's really a great way to encourage students to drive their own learning and follow their own curiosities based on their patient encounters. And oftentimes what I've seen with this is that students will actually set higher expectations for themselves than we tend to have as the program, because they want to learn more specific to that patient encounter. So when you do have a student evaluation, or excuse me, a self-evaluation set up for students to complete, I would often recommend having an open-ended question in there where students can name one or two, their own learning objectives, future learning objectives that they want to be able to learn about, and then encourage them to, whether it's through a formal exercise where they complete an assignment, or whether it's through conversation with you where they would go and report back to you, that so that they can go and again access this information and really be self-driven learners. I know that oftentimes in many different program types, there is that accreditation standard that students will be lifelong learners, and this is a great way to promote students being a lifelong learner by having them complete those tasks related to that while they're in our either pre-clerkship or clerkship years in our program. And of course, we'll talk about OSCEs. It's tough to talk about clinical or preclinical evaluations and not talk about OSCEs, but I made that note with the emoji to myself to not talk about it quite yet. Okay, so let's move on. So I'm gonna jump right into these next 3 or 4 slides and really focus on the logistical barriers I mentioned previously. And so first and foremost is communication. And again, when we have, already with healthcare education programs, there's a lot of moving parts, a lot of logistics involved. And because of that, communication can be a really difficult thing that can often slip through the cracks. And so we want to make sure that, and this is communication between the support staff that often are helping to operate the logistics of the curriculum, and then also with faculty, both those in the building and in the clinic, and of course students are a big part of that, the communication issues that we'll see sometimes with evaluations as well. One recommendation, first and foremost, it's a simple one but often can be overlooked, is to set automatic email reminders so that when your students or faculty have evaluations to complete, if they aren't completed, they will get those reminders. These can be set up in advance, time and date, so that if they aren't completed, they do get completed. So make sure that that's a part of the process that you set up. Next, rubric items. You can see in this this swanky GIF that I can't take credit for making. Austin made this, so thank you, Austin. This is just a GIF of evaluations, or excuse me, a rubric evaluation in Leo, and how quickly and easily it can be completed, in this case on an iPhone. So with rubric items, and especially if you're giving student feedback, and this is true even of peer feedback, it's great to use rubrics so that you can get more specific feedback to your students. I have worked in clinical situations where the evaluation was actually more of a checklist. It's and truly a yes or no type of checklist. And this is something that, as much as possible, to give truly quality feedback to students, we want to avoid, because the student could technically, you could click yes, they did take the history. However, they could also have taken it and done it incorrectly at the same time. So it's one of those items where you want to make sure you're giving true feedback on student performance, and a rubric allows you to do that. I also would recommend, as much as possible, to give students comments. I know that I've worked with programs in the past where, let's say your rubric is out of 5 points. If you give them a 3 or lower, or a 2 or lower, you have to, it's a policy that you put a comment with it. I would always strongly suggest, if you're not giving a student a perfect score, to give them some sort of feedback on what they can do to make that the most ideal score for that item. Again, it gives quality feedback. It's also great when you think about peer evaluations with a rubric evaluation. Not only is that valuable for the feedback that the student is receiving, who's being evaluated, but the student that's giving the feedback as well is able to think critically in that moment about about the level of their peers' score, and that it can actually help them be reflective about their own performance as well. Whether it's witnessing a classmate that's gone above and beyond what they tend to perform, or if they're able to help someone out and give them quality feedback. We often learn through teaching. I know those of you on today that are in faculty or teaching roles, we most certainly all do learn through teaching, and that can be valuable for students in that moment as well. Again, that extra information is another just boost to communication. In Leo, for example, faculty advisors can view completed evaluations. So to help streamline, and we'll talk about timeliness a little bit on the next 2 slides, but to help streamline this process of students getting their evaluation or having the evaluation completed, students are able to view their own evaluation. But there's another party in there that should be able to see these evaluations as well, and it's the faculty advisors. And so in Leo, in the student's academic portrait, which is somewhat of a student portfolio for those that aren't used to it, it allows those faculty advisors to log in and see the student information. It's also a great way, if you're concerned about any FERPA issues on how you share grades throughout your program. It is a secure login for those advisors, that they're granted specific access to those students. So it's one less security issue you'll have to worry with there. And finally, I mentioned I would talk a bit about self-evaluation today. One great way of communication as well is kind of self-communication for students. And they want to be, so with these clinical assessments that we have students complete, it's a great practice to have students evaluate themselves, and not just to reflect in an abstract way, but something like we have on the screen with a rubric or an actual number type of evaluation, so they can give themselves a score and compare that to the faculty score that they've received. And so I'm sure we've all seen this throughout our careers, where students can have a higher sense of confidence, and actually it might be a little bit misguided, And so we want to avoid that as early as possible as well. So if you can have students, even in those preclinical years, evaluate themselves and compare that to the preceptor evaluation, it lets them have a better idea on how to evaluate themselves moving forward so that they can be more accurate and more honest with themselves to make that a true, again, we want to make these learning experiences that improve future outcomes for students. Okay, we're going to jump into timeliness. I know I just mentioned those, kind of set myself up with a segue there on timeliness. And when we give students feedback, and throughout the course of medical education, evaluations have been done numerous ways. I'm sure that there's some of us out there that have had them completed with paper. We may have used that old process of faxing or emailing or things of that nature to get information from the clinic back to the school and to the students. And that's great for the even those slower processes. You can still click the check boxes for for accreditation purposes, saying yes, we did do evals. However, the main point of timeliness, and really these evals, should be to influence improve student outcomes and student performance. So we want to get that feedback to students when it matters, and that's as soon as possible after the process, or excuse me, after the evaluation or the clinical experience or the classroom experience for didactic sake. And so again, in Leo, I have a little picture here to the right, but once approved, the comments that you make and just the overall evaluations that are completed are made available directly to students in their academic portrait. So students can go in, and I have a picture here. We'll see Lucy Stone again in today's presentation, but I have a picture here of Lucy Stone's academic portrait in her mobile view. And so you can see here we have these different sections. We have evaluations to be done. That goes back to the reminders we saw earlier. Lucy has to complete one evaluation, evaluations that she has completed, and then evaluations of me by others. And that's the ones we have below here. That's what we're seeing there, that Lucy in her portrait. I'm showing 2 of the 3 right now in the screenshot that I took. And we can see that she has had 2 that she can click in. She can see who's done it, when they've done it, and then again, any comments that they've received. And Lucy can also collaborate with her advisors on those if there is an issue there. Okay, moving along with timeliness. I apologize, I'm now holding my monitor because Dexter's trying to knock it off. Thanks, Dex. So moving along with timeliness here is the on-demand evaluations. And I mentioned at the top we would talk about that. If you aren't familiar with on-demand evaluations, they're just something you can do on the fly, right now. And so the on-demand evaluations, obviously with the appropriate setup in the back end, you'll be able to have both students or faculty initiate an evaluation, both in a didactic or clinical moment. And in this case, I actually will have a little bit of a quick walkthrough so I can show you how to access those. But there's really 2 main areas to do it. This is a screenshot on the screen. They can request an eval or evaluate someone else. So it's pretty clear. And this will then be for when you have a student request an evaluation of you, the faculty member, it actually goes directly to your email. And I'll get into some more logistics with that momentarily. But it goes directly to your email. It looks great on mobile. I actually have a prop here today. It is my cell phone, and I will show you what it looks like on mobile before the end of today. And it's one big point and one big takeaway I want to show with this today is the idea of the clinical skills or the pre-clerkship, easy for me to say, pre-clerkship assessments. And this is the ASCII part that I promised earlier with the little thanking emoji. So and I know this is probably going to hit home with Austin as well because we've experienced some of these together. But in a pre-clerkship setting or a clinical skills setting, there's, again, I've meant if you are, counting the times I said logistical today, I'm sure you're on all your fingers and your toes are being used. But it can be a logistical nightmare when you have 100+ students and 10 to 12 to how many are preceptors that you have in the different clinical evaluation rooms. And this is when we could be all together, and there's different hurdles to face if we're doing these over Zoom today. But it can be the planning and the assignment of all of the the students with the preceptors, with the standardized patients can be a big ask when we're setting things up. And that doesn't take into account the outliers of a preceptor not being able to make it, oh, God forbid, no call, no showing, or student schedule changing to where then the different rooms are changing, and it can very quickly become a pain in the neck to be able to have to run these OSCEs. And so with an on-demand eval, I would really recommend having your faculty or your preceptors that are going to be doing the evaluation in the observation room, have them logged into Leo and ready to run an on-demand evaluation. The next slide is actually going to show you exactly what that looks like. And then when the student comes in, they would introduce themselves, student, doctor, whomever, and the faculty member can very easily click the evaluate someone else button we're seeing on my screen right now, and then choose that student's name and then begin that evaluation, so that you don't have to worry about room assignments specifically. I mean, I would still recommend to have those room assignments in advance to make this as smooth as possible. But if there are changes, you're able to be flexible with those changes. They can complete the OSCE or the evaluation of the student in that clinical skills in the lab with the standardized patient there. Submit it. At the end of the day, they can be approved and then made available for students to evaluate. And it's just a nice way to streamline that process, again, to overcome timeliness issues, absolutely, as well as just other logistical barriers that we see there. So the YouTube video here that is playing is actually, I said I would show what it looks like. The faculty member can truly log in and click on their eval portal, and it takes them directly to their evaluations. They can click evaluate someone else, select the course. I do this a lot. That's why I have all those courses in there. Select the evaluation form and select the student. So student Dr. Burton has walked into the room and introduces himself, and the faculty member can now begin that evaluation. And so it really is something that can be that simple of a process for those faculty members that are coming in for that to help with the preceptors. This next part, as I'm talking, is a transition here for training, and that really helps eliminate a lot of training issues you may have if they just have to simply, once they come in, they log in, and from there I think I clicked 2 buttons to get to the evaluation. So it is a nice, easy way, again, to be mobile throughout that process. And then finally, the last logistical barrier that jumps up, and I see this quite a bit with the schools that I've worked with, is being able to to train those clinical faculty members that aren't in the building. So we often see this with if we have a clinical assessments being done and you have sites throughout your state or region or however your school does this, it can be really difficult to get training materials out to those faculty members in a way, especially if you're using a new technology, in a way that's both efficient with the timeliness we saw before, but also just in a way that they can complete them. And so as much as possible, we want to make training a non-issue for those faculty. And I'm sure many of us have seen this as well. When you have those preceptors come in, they might only be in your building to do these evaluations 2, 3, 4 times a semester. And I think in my career, I've had the ability to meet with those faculty face-to-face 1 time before we're then doing the evaluation process. So it's really unfair to them to expect them to be able to do these trainings without an issue when they're when they or do these evaluations without issue when they really have had very little opportunity to train for it. And they may have had a training weeks ago, and then they're coming in and they're expected to be able to complete it, or complete these evaluations now. So with Leo, what we can do is we can bypass the need for training for these clinical faculty, and the evaluations can actually be sent directly to their email, and you can also use the email of choice. So we've seen this a bunch where faculty members may have your official school email account, however, they don't actually log into it much. So what we want to be able to do is have them use the email address that's most comfortable to them in this process. And then, of course, it'll send directly to them, no need to log in. And I'm actually going to we're going to do a quick live look at this now. So I'm going to flip over to my presentation system, and I am currently in here as Lucy Stone. So if Lucy's logged in and she sees her calendar and all these great things here, she can go to her eval portal and she can click on request an evaluation. We're going to click this course, the on-demand form, and we're going to make the faculty member Robert Guthrie. And she can write a note here, but because I know if I type live in front of people, I'm probably going to make a typo. I'm going to skip that part and go right to submit. So here I have my phone, and I actually am set up as, I'm actually going to stop sharing my screen so you can see me on the big screen. So here's my phone, and you can see I have my little Gmail notification there, which just happened. Now I can log in. I have my email sent right here. So there's my inbox, and I can go ahead and view this evaluation now. And as quick as my at-home internet will pull up, which I think I'm taxing the bandwidth a little bit right now, I can see that I have this evaluation ready to go for the student, just like we saw before. So the faculty members very easily can, again, without having to log in your clerkship, can have the student evaluate it. That's all I did on my part as the faculty member was clicked on my own email address that's on my phone. Again, there's no need to share devices. The student sharing anything with me, this is obviously my phone. And I was able to open my own email, click in. And just for those of you that are concerned about any sort of logistical or security concerns, the only thing I can do in Leo going forward from this current login is complete this on-demand evaluation. After submitting it, I won't be able to access the rest of the platform. It's just that one completion there. So let's go back to sharing my screen. And let's go back into presentation mode. And Haley, if I'm showing anything other than my presentation, just jump in and start screaming. Otherwise, I'm going to keep on talking. Okay, so that's the quick little how-to I wanted to show with that on the logistical barriers. If you do have any questions on that, feel free to throw it into the Q&A or the chat, or follow up with Austin or Haley or myself afterward. So I did mention on the abstract for today's presentation that we do want, that evaluations are something we have to do for accreditation, and therefore we want this to be a part of our accreditation readiness process. And in Leo, in addition to doing your typical curriculum mapping, you can also map your evaluation items, or by items I mean individual questions. So those evaluation or clinical assessment questions can be mapped to themes in Leo. And so let's say if you're using it for an OSCE, for example, and you have the different areas of student performance. So we want history taking and physical, taking a physical exam, and oh gosh, I'm probably gonna come up with a bad example here, like creating a diagnosis for the patient. Those can all be themes that you create, and themes are also called like coils or threads, items that you can have a customized group of these themes, like those associated with OSCEs, and then you can map each question to those themes. And as you can see on the screen, this is just a picture of the mapping of a theme. You can have several items mapped to each one. So when you're creating your evaluations, don't forget this part of the process. It is a great way of, when you create the questions, quickly hop in. It's actually in the area where you create and or edit your question item. So while you're in there, there's a little button that says themes. You can, or a little column of themes. You can click the number there and easily add as many themes as you want. As you can see here, I very quickly and arbitrarily added 7 themes to map to the question that I was in at this. There's also a list of the available themes. This is just the group that I had available with this, but again, you can have different ones. But again, it's a nice thing. I would say a recommendation with this too is to be proactive. So as you create your questions, obviously, if you're creating your questions for an OSCE, you probably already have them grouped anyway. Let's say if you're doing them on paper, for example. So, and I'm sorry, I have to move my cat off my computer because it's going to overheat. Sorry, buddy. These are moments I didn't really expect to ever do on webinars, so I had to give them all from home. So you can then, again, map those themes as you're creating those questions. You already have them, I'm assumed, sectioned off by history and physical and diagnoses and all those things anyway. So just as you're creating them, keep them in those clusters and add them to themes. And it'll be something that will help your accreditation readiness when you are reporting back on your evals and how they tie to student performance and competencies that you need to meet. The last thing today before we get to questions and answers I wanted to get to is just some tips on inter-rater reliability. We all know that inter-rater reliability can be something really difficult to achieve across the board. I've mentioned at least 4 times today the amount of cooks in the kitchen and how many people that are involved in creating a, in not just creating the evaluation, but then the whole process, the students involved, the faculty, the clinicians, and we know that there's many other staff members involved in that process as well, typically. So we know, and especially if you have faculty throughout the state or those preceptors that are coming in, again, just a handful of times every semester or even calendar year, that we want to get them on the same page as much as possible. And the easiest way to do that is with some proactive training. The utilization of video in this. Just so, and we know this, we've talked about the beginning about the whole point behind what we're doing here is trying to improve student performance, improve the quality of feedback that we get to students, whether that's through their own evaluation of themselves, from their peer, or as we see quite often from a preceptor, and make that something usable for their learning. And the best way to make that truly a valuable learning experience is to have reliability across those that are giving feedback to students. For those of us that have been in medical schools or any other type of healthcare education program, we all can probably sit there and think right now of the faculty members we've heard of, whether we've witnessed it firsthand or whether this could be you, the faculty member too I'm referencing, that or that we hear the students talk about, that are the easy ones that are probably going to be the easy graders. And if you do just enough, you're probably going to get a passing grade. And the ones that can be pretty strict and can knock points off for even the smallest of detail. And the students, the feedback students get, and especially their score, shouldn't be dependent on who the grader is necessarily. It should be about their performance consistently across the program. So with this, I would create a faculty development course in Leo to where your faculty would be kind of the student role here, because these are the ones that we're training. And the way that I've worked with institutions in the past with this is to do a lot of this through video. So I would actually provide examples of different levels of performances of students. So perfect score, one that's an aggregate score of 8 out of 10, one that's an aggregate score of 6 out of 10. And I would provide the rubrics with them as well on what the ideal scoring was for that video that the faculty watched. So they can kind of see a baseline of what the expectation is for the ideal student performance, one that needs improvement, and one that may be at or below failing and needs quite a bit of improvement. I also would have them, I would provide videos for them to actually have some mock evaluations to perform themselves without that rubric scoring already provided to them. So I would give them the faculty had the videos loaded into Leo along with the evaluation they need to complete, view the video, and I would have several faculty complete that evaluations of the same exact videos. So we have some comparison there across them. And then at the end, I would for sure give them, I would have some follow-up assessment and conversation as needed. If this is something that you don't want to be a big ask for your faculty members, this is something you can have it available to them over time. And I would have them complete it obviously before their first student encounter. But could be something as simple as viewing a short video, getting the rubric with it, doing 2 or 3 of their own evaluations, and then giving them feedback on what the ideal answer was or what the ideal score should have been for those students, really to help calibrate them to be on the similar page across your institution. So with that, I'm just going to go back through our objectives for the day very quickly, just to make sure that we hit them all, and to give you guys time. If there are questions, as Haley mentioned at the top, go ahead and jump in and throw them into that Q&A feature, and Haley will share them with me now. And if you have other things to share with the group, the chat is perfectly okay to use for that as well. But looking back at today's objectives, again, we wanted to improve the effectiveness of our evaluations. Through that effectiveness, we want I'm kind of working backwards here. We want to have inter-rater reliability, be proactive about the training, and have a training course for faculty there. And then also, we want to be able to get timely feedback, feedback that is specific to student performance, and not just a yes, no, but if we can, with a rubric and numbers-based evaluation. And again, have that available to them in their approved and in their academic portrait, but also viewable by faculty advisors. I mentioned quite a bit with these logistical barriers today. I just talked about timeliness. Again, training. This is something that, with especially for your preceptors or clinical faculty, that with the setup of on-demand evaluations, and faculty can also access, if you have pre-scheduled evaluations in your platform and aren't using on-demand, faculty can still receive those in their email as well. So whether it's the on-demand or the schedule, they can access those in their email. But have those set to where they can access those easily without needing any training. They can complete them. There's no time lag, because once they hit submit, it's then it's in Leo, ready to be approved for student viewing. And then finally, we wanted to be able to or administer our scheduled or on-demand evals. Hopefully the quick video, and we can make the slides available today as well as the video. Hopefully that quick video can help illustrate that for you. And at this point in time, we do actually have a little extra time for some questions. So I'm going to turn it back to my colleague, Haley Diaz, and take some questions. Thanks, everyone.
Yeah, thank you so much, Dan. And that will conclude our presentation today. Best Results, Comprehensive Evaluations, and Clinical Assessments. Thank you so much, Dan, again, for a very engaging and very informative presentation. So now we'll take some questions and a little Q&A session. So feel free to drop them into the chat or just shoot them to me directly. We did have a couple questions roll in. So to start us off, the first question is, so both students and faculty can request and initiate evaluations. Can you customize this? We don't want our students evaluating faculty in our system at their own discretion. It's kind of a little halfway part. Oh, I think you're muted.
Thank you, Haley. That's a great question. So yeah, this isn't something that is just kind of like the wild, wild west and opens for anyone to willy-nilly evaluate whomever. There are these are settings that you would put in place to make it allowable for faculty to create those on-demand evaluations or complete those on-demand evaluations, and same for the students. So these are definitely options that can be selected, and not something that students can just, when they are having a bad day and had a rough interaction with a faculty member, can start firing off evaluations. That's a terrific question. I apologize for not saying that earlier.
Good. Just got to cover all our bases here. Another question is, for the standardized patient example where a preceptor can evaluate a student on demand, can a preceptor use their iPhone to complete them, or is a laptop required?
Great question. So for the on-demand evals, or really any eval, it can be done with phone, tablet, or laptop. So it was created in a way that it scales very well. It scales very well to mobile. In fact, the majority of times that I am actually in and working with evaluations, I tend to use my phone. It's just the easiest that way. And like most of you, I'm probably on the go with it and just want to be able to do it quickly and submit.
Got it. That was from one of our attendees, so good. And another one that we got in is, when you showed us your phone, did I see that the student's picture on the screen? Someone, asked about that.
Yeah, no, great question. I guess I can go back to my phone here. and see if I can get this to pull back up. It was the student's picture that you saw on the screen, by the way. Otherwise, I would be pulling it back up. I pulled up a different one than Lucy. This is Felix Anderson there, but you can see it does have their image there. So when you have the student, photo composite in Leo, it's associated with the student account. And just one more kind of security check that you are meeting with the appropriate student. And also, it's a great way if you met with or evaluated a student in a clinical setting, but didn't have time to complete that on-demand eval right at that moment. It's not like you have to complete it then, and if you walk away, it times out. You can, I can have this one on my phone throughout the day and go back to it later. If you do go back, again, it's nice to have that student picture there as a nice reminder of who exactly you're evaluating in that moment.
Wow, thanks, Dan. All great questions, all great answers. But I think that's it for right now. So I think that'll conclude our question and answer session. And I think we're also good right at time as well. So if you have any further questions or just think of any later, feel free to just shoot us them individually. We really appreciate everyone's attendance in today's webinar for Best Results, Comprehensive Evaluations, and Clinical Assessments. This is the second in our 4 Best Results series. So we hope all the information today that was presented has been super helpful and engaging. We'll make sure to share the recording with y'all in an email, and we'll follow up with anybody individually if they have any questions. So thanks again, everybody, for y'all's attendance and participation today. We really do appreciate it. Be on the lookout for some upcoming webinars in the 4 Best Results series. Have a great rest of your all Tuesday. Bye, y'all. Thank you.
Thanks, everyone.